I've always heard that you shouldn't mess with Texas. And what we've been learning this week is that the women of Texas are rising up with incredible strength. And I'm so delighted to welcome to the show tonight, Jimmy and JoAnne Moriarty have invited a very special guest, Dr. Lozano. Welcome to the show. How are you, Doctor?
I'm fine, thank you.
Jimmy, JoAnne, you guys doing well?
Right, we're doing great.
We're doing fine, thank you.
We're so proud that you could join us tonight,
Yes,
Doctor.
we're so
Thank
happy
you
to
so much.
see you again. We met Dr. Lozano back in 2013 in Dallas.
Yeah.
Now, we should clarify for our viewers, we're ordinarily talking about Libya on Unseen Libya with Jimmy and JoAnne Moriarty. Regular viewers of the show know that Jimmy and JoAnne actually were living in Libya for a number of years, where they started an oil services business. It was quickly ended when the United States invaded and destroyed Libya. But today we're going to take just a little sidetrack from our normal conversation to discuss what's going on in Texas. Dr. Lozano, you run a clinic, a family clinic there in Texas. Can you tell us a bit about your background and why you chose to join us tonight and what you'd like to share with our audience?
Well, my background is very simple. I am a political refugee from Cuba. I guess you could call me the American dream. Came here as a child fleeing communism, always wanted to be a physician, and truly anything is possible in America. And through much hard work and a lot of wonderful people that guided me, I was able to do that. I am currently in my office. I've been here for 20 years, and about 2013, maybe a little bit before that, decided I needed to be a little bit more active politically because of changes that I saw coming in through Obamacare that reminded me a lot of the situation that caused my family to flee from Cuba. Wow. And so I've had quite a ride for the last couple of years fighting Obamacare, and it just was not anything normal for me to stand up and say something against what I've been seeing in reference to this pandemic that we are now facing in our country. And I'm horrified at how we have addressed this issue and decided last weekend to just be a little vocal. Had some of my friends ask me if I would come out and speak for a few minutes, and I guess it's caused quite a stir.
She burned the barn down.
Right. And we're going to have a bit of that video later in the segment. I know you only have limited time with us tonight, Doctor, so we'll share that video segment after after you have to go. So I'm surprised that Obamacare was reminiscent of Cuba, but actually now that you mention it, I'm not that surprised because, socializing medicine, this is an issue that's very close to me. Now, you're a doctor. You earn your living by being a doctor. We all agree we want a capitalist society. A lot of people seem to feel that healthcare is their God-given right and it should be free. But of course, nothing is free. The government would pay for it through taxes. The question that I always ask for people who present that argument is, isn't the first step in proper healthcare healthy food? How come I can't go to the supermarket for free? Don't I need a home where I can live in shelter and cleanliness? How come my house isn't free? And if we go down this road, everything would be free, wouldn't it?
Well, it's actually quite a big deception. But if you do a little study at most countries that are communist, Russia, China, and obviously Cuba, there has to be a way to control the people. And so you control the people by taking over their health care. And so although in Cuba, healthcare is free, the problem you run into is that they have no medicines. And so I very frequently get requests from my family to send blood pressure medication, diabetic medication. I'm like, well, which one do you want? Well, it doesn't matter. We have nothing. So just send whatever you have.
Wow.
So free means that nobody has anything. And the thing that's been the most interesting to me during this pandemic is that you can also control people through fear. And I think that's what we have. We have just unbelievable amount of fear and panic in our communities now in reference to this COVID-19 virus, which, as you will very quickly find out is very easily treated if we treat patients appropriately by getting them into our offices and treating them now, not waiting until they're so sick because they've quarantined for 14 days that they arrive hypoxic in our emergency rooms. So I'm here to bring calm to the situation so that other physicians will feel comfortable treating patients with COVID in their offices.
And hypoxic means they're not able to oxygenate their blood?
So hypoxic means that you feel like you can't take enough oxygen in, like you're short of breath. And so this is one of the symptoms that we see with this COVID-19 virus. Normally, these patients start with fevers. They have low-grade fevers, and they have body aches, and they have chills. And primarily, they have these symptoms at nighttime. And the first time it happens, if it happens to be a woman, she thinks maybe a little menopausal symptom here or there, but it's consistent. It's every single day, and it starts growing on itself. And what I've seen and what I've experienced in my office with some of the stories that I've heard from my patients is that they're going to local hospitals or to other clinics or other urgent care centers, and they're being sent home. And they've said, well, you're not sick enough to be in the hospital, so go home and quarantine yourself. Take Tylenol for your fever. Well, this is actually the wrong thing to do because what I've noticed in my practice is that if you send them home and you don't treat them, they get worse and they get scared. And I think that's a bad combination. In fact, I think it's deadly. And so if we could send them from the emergency rooms with some form of treatment, I think we can resolve a huge amount of the sharing of this virus among family members. And I think it's just a panic. We, as physicians, we really have had no guidance from some of our organizations as to how to approach and how to treat these patients. They've told us how to, check them, how to test them. But okay, we can test it. But if it looks like a duck and it walks like a duck, it's a duck, it's a duck, it's a duck. How do we treat them? And so we've had no guidance there. And I was just quite fortunate one day during the lunch hour to have had the opportunity to be at home watching a television. I guess the president was talking with some of the news media, and he was so excited. He shared the fact that there had been a physician in, I believe it was Paris or France, that had treated 29 of these COVID patients. And he said they all got better. And so I immediately perked up and I heard it, and he repeated it again. He was very excited, very optimistic. And I heard this for 3 weeks. And so when that first patient walked into my clinic, I was ready. There was I wasn't concerned. I wasn't worried because I had done my thorough research. I had gone and I'd read the paper from France and the physician. And I found another paper, another physician in Germany and another one in England. And so I felt pretty comfortable. Doctors don't tend to lie about having good results in their clinical setting. These are not research people. They're not people that are looking for grants. These are just regular doctors like me that have clinics that open from 8 to 5. So it was very easy for me to provide this treatment. But you would be surprised how many of my colleagues, my friends, other physicians that I know hadn't had the opportunity to listen to the President of the United States. They didn't hear Donald Trump tell us about hydroxychloroquine. And they're very reluctant to use this drug because what they have heard is that they're going to be sanctioned by our licensing entities, that the pharmacies are not going to fill this for us, that it's very dangerous. And that's just absolutely ridiculous. I mean, this is a drug that I'm very familiar with. I have used often in my practice over the last 20 years. I use it a lot for my patients that are going to travel to Africa. And I have quite a few of those that go back and visit their families, and we treat for malaria, to prevention of malaria. And if you do a little research on this drug, I mean, it's been around for 60 years. It has no side effects. They call it the candy for rheumatoid arthritis. So the fact that the President of the United States has been muzzled, and that the American Medical Association and the FDA and all these other bureaucracies are trying to push an unknown, expensive, highly toxic remdesivir, to me, is shocking, absolutely shocking. And I felt like I had to say something, and that's what I did last Saturday.
This is really.
What do you see Ask her
Sorry,
what
JoAnne.
do you see with your patients that you treat with with that stuff?
Hydroxychloroquine.
Yeah, it's
Yeah.
hydroxychloroquine, and
Yeah.
the name brand is Plaquenil. It's called Plaquenil, and it's 200 milligrams. I dose it twice a day for 5 days, and what I see is just remarkable. I mean, it actually surprised me. Uh, the first patient that came in was really, really sick, and it was just completely obvious that she had this, and she knew that she had it. But here's the interesting thing: she came in waving a negative COVID test. And
Wow.
so right there, I knew that those tests were not specific, false positives, false negatives, and that was not the way to go. I just don't understand why we're so focused on documenting COVID cases instead of being focused on treating these people and with medications that are so inexpensive. I mean, you're spending $13 to $15 for a 5-day course. But she was very diaphoretic. Her skin was wet and sweaty. She had fever in my office. She was scared, visibly scared. Her blood pressure was very high. Her heart rate was in the 130s. She presented with a history of rheumatoid arthritis, and her rheumatologist had actually put her on, and this is very interesting, had actually put her on hydroxychloroquine. She was taking Plaquenil. Now, I didn't know it at the time when she walked in, and her dose was once a day. And it's interesting. I'm just going to take a side note here. I did a little research. I heard that we have about 77,000 people that are being treated for rheumatoid arthritis with Plaquenil or hydroxychloroquine. And none of these patients have come back positive for COVID. Not a single patient with rheumatoid arthritis treated with Plaquenil has been diagnosed with, positive COVID test. Now, that doesn't mean they don't get it and they don't have it. It means that the test is not picking these people up because they're already on this life-saving drug. So what we did is I finally discovered the next day that she was on hydroxychloroquine. We had some blood tests that came back that were abnormal. I told her to double her dose and added the Zithromax. And within 24 hours, her fever was completely gone. Her breathing was 75% improved. By day 2, she was 100% back to normal. Still afraid, still questioning how she could possibly have COVID if she had a negative COVID test. And so I want to emphasize that. A negative COVID test does not mean you do not have COVID. If you have a fever, if it comes at night, if you have night sweats, if you're diaphoretic, meaning your skin is wet, and if you have shortness of breath, and she didn't even realize that she was short of breath. When I had her take a deep breath so I could listen to her lungs, it kicked her into a coughing fit that lasted 2 to 3 minutes until she could compose herself. Her oxygenation through a pulse oximeter was running about 89% or 90%, which is very low. And again, I want to emphasize just the anxiety and the fear that she had. I mean, that I think made things worse. But yeah, it's a remarkable drug. And I am so positive that it will help every single patient that takes it. That I wanted to come out and repeat what I did on Saturday and hope that, someone in your audience will hear it. And if they have a family member that's in the hospital and they're not giving your family member this medication, you need to go fight. You need to go fight for the right to use this drug.
Now, just to clarify, doctor, because we've got a lot of questions coming here in the comments, your presence on the show here today is not specifically to diagnose or treat anyone's condition. You're just sharing your personal anecdotal experience in using this pharmaceutical product in your practice. And it's helpful information for other doctors. Obviously, everyone should consult their physician about their personal medical condition before engaging in any kind of treatment. But what I'm hearing you say echoes a lot of the things we've heard other doctors say. Hydroxychloroquine in its various generic forms and its brand names is a well understood drug that's been prescribed for decades, literally. It's well tolerated in a broad range of patients. Obviously, no drug is suitable for everyone, but you have seen in your practice sufficient positive outcomes that you're very optimistic about this. And I agree with what you're saying, that it doesn't make any sense that something that's been around for so long, that has relatively few side effects and is so well tolerated by such a broad range of patients, should be so slammed. I mean, we've got mainstream media, we've got mainstream medical associations just absolutely poo-pooing any notion of even testing this. Obviously, this is something we want to have clinical trials for, a new off-label indication to get some more, scientific data. Yeah,
Jason, it's worse than that, because after Dr. Lozano prescribed this, the pharmacies had been instructed not to fill it and accept. So
has that ever happened before in any circumstance?
So in my 29 years of practicing medicine, I have never had a pharmacy specifically request a diagnosis prior to filling a prescription. I mean, it's pretty well known that doctors send prescriptions with instructions and number of pills, and the pharmacist, obviously checks the background of the patient to make sure that we're not going to have any side effects or any cross reactions with other drugs that may have been purchased from another physician. And so I was quite alarmed that happened, and actually a little frustrated, because it required me leaving a patient exam room to answer the phone. And when I spoke with the pharmacist, he told me I just need to know the diagnosis. And I very quickly explained to him that I could not share that with him for HIPAA reasons. And he tried to reassure me that we were both on the same team and I could share that information. And I told him I just didn't really feel comfortable, that he'd never asked me for that before. He told me that there has been a change in the pharmaceutical board, their licensing board. They have now mandated, and this started, I think it was mid-March, they've mandated the pharmacies to have a diagnosis before hydroxychloroquine or Plaquenil can be prescribed, and also Zithromax. I think there might be one or two other drugs in that particular family of drugs. And he told me, he said, I just can't fill it without a diagnosis. And so, needless to say, I got kind of heated, and I was very distraught. I reached out to the Attorney General of Texas, Ken Paxton. I also reached out to Senator Bob Hall, who's just been so helpful in guiding me. We were able to talk to the pharmacy board, and I was able to share my concerns and letting them know that by doing this, what's happening is, because doctors are not used to having to write diagnosis, these prescriptions are not being dispensed at the appropriate time. And sometimes there's a delay in 1 or 2 days in dispensing this medicine, which is in every single pharmacy. It's not an availability. Everybody has it. But if you prescribe something on Friday and you don't get the call back from the pharmacist as to the diagnosis, that patient's going to have to wait until Monday. With this tricky virus, this COVID-19, if we're having problems already with our lungs, that's just way too long. Patients can go through the cracks, and so we want to prevent that. And so essentially what I was told by the pharmacy board is just give them a diagnosis, just whatever you want to give them. Just give them diagnosis.
But isn't this crazy to have bureaucrats and pharmacists second guessing a physician who has done an examination of a patient and made a determination? This is not how medicine is supposed to work.
Well, and you have to remember too that the liability is all mine. I take full liability when I prescribe a medication. So the pharmacy board let me know that the reason they were doing this because they were fearful that people were hoarding this drug. And they had doctors that were prescribing, prescriptions that had 400 pills. And so, in my opinion, if that happens, it's very, very easy to identify that physician and reach out to him and maybe even sanction him. There's absolutely no need to have 400 pills of hydroxychloroquine. I did have a rush of patients that called me on the phone, my regular patients asking me for prophylaxis, that they wanted to have this medication at home, and those were denied. And I would think that in a pandemic, physicians would not want to hoard this drug or give it out unless the patient is actually showing symptoms. I mean, we're educated people, and we know the need to have availability of drugs, and we don't want to use drugs if the patient is not showing symptoms.
Yeah.
I have not taken the drug. I treated people, started treating people mid-March, and I have not taken hydroxychloroquine. I've not been infected. I haven't had any symptoms. And I have made sure that I've seen all of the patients with hydroxychloroquine. I've tried to take my staff away from them and let it be more of an interaction with me.
So what they told you, or what you're doing now, is if they ask for the diagnosis, you say, yeah, it's an ingrown toenail. Give me hydroxychloroquine.
Yeah,
You can say whatever you want.
So I don't really want to get under their skin, because, we really do have to work together. And trust me when I tell you that I've had a lot of time to talk to pharmacists on the phone. Their hands are tied. This is not something that they want to do. This is their licensing board. And the licensing board has said that they're doing this in order to protect the supply. But again, it sounds great. So did Obamacare. Obamacare sounded great. Free medicine for all. And it turns out that no medicine for nobody. And so what I do, there are multiple things that you can use hydroxychloroquine for. One is rheumatoid arthritis. The other one is lupus. And so depending on what kind of a mood I'm in, most people have arthritis.
Right. Now, it's interesting to note.
I don't want to fight with them, and I don't want to put them in a tough spot.
Right. So one of the things that's advantageous from a patient standpoint about hydroxychloroquine, because it's been around so long, it's no longer a patented product that's owned by a particular pharmaceutical company. The formulation of it is essentially an open source thing that any generic drug manufacturer can make. And this is part of what drives pricing down in any market when there's competition to make it. So the Canadian generic pharmaceutical manufacturer Apotex has donated 2 million doses of hydroxychloroquine specifically for a double-blind, control study. What do they call those again? The clinical trial. And this is what we need to determine scientifically the efficacy of such a drug. Whenever somebody like Dr. Fauci says, oh, well, there's no proof that there's efficacy in this, what he's saying is we haven't gone through this process of doing this test. And as you point out, Fauci has been promoting a patented drug, remdesivir, that's very expensive for patients to purchase. The money for it would go directly to a pharmaceutical company. I haven't personally drilled this down, but I wouldn't be the least bit surprised if Dr. Fauci had some kind of benefit that he would derive from that. Now, Dr. Lozano, we've seen...
We hate to see ill of the man, but remdesivir is $900 a vial and can only be administered in the hospital. So obviously that's a patient that was not treated for weeks before landing in the hospital, right? Because remember, they're sending them home. And again, that's the concern is, why are we not looking at trials with hydroxychloroquine? That's why when we started this, one of the things I told you is I can only speak about the patients in my office. You can't tell me that they're not getting better, because I'm watching them get better every single day. In fact, before coming on with you today, I made a quick call to a patient that I saw today. And this patient came in at 2:00, and it's 7:30 or around there, and patient's already feeling much better. Totally shocking that within just a few hours. And what I've done is I've tried to get my patients to fill their medications at pharmacies really close to me, not necessarily their regular pharmacies, because I just don't want to fight with the pharmacist anymore. And my guys here understand that I am going to prescribe this and that these patients need it.
Right. So it's interesting to note that this Gilead Pharmaceuticals that makes this remdesivir, there was an article there saying that they've stopped their clinical trial. I'm not sure why that would be, but when we just Google Gilead Sciences and Bill Gates, it comes up right here.
So here's something real interesting, Jason. About a week and a half ago, I saw something come out that the remdesivir was not working, that they were having side effects, and they were very disappointed in the results of the clinical trial. And the very next day, I read that the FDA has approved this as an amazing drug and that the clinical trials are doing great. Now, I wish I could go back and find that. I'm sure that it's somewhere on the internet, and chances are it's already been removed.
Wow.
Oh, yeah. What are the side effects, do you know, to that drug?
Remdesivir. So
yeah.
Usually these drugs have liver toxicity. And I will tell you that that's very important, because in every single one of the patients that I have treated in my office, I've done blood work on every single patient, and their liver enzymes have been elevated. And these are patients, some of them that have been known to me. A lot of them are brand new, but some of them that I have known and I have treated in previous years, and I have existing blood work, and they've never had liver problems before. And now that they're infected with COVID, their liver enzymes are high. In fact, that's one of the things that I was the most interested about when I realized this was happening and that there was a trend of this elevation of the liver enzymes. I actually reached out to a physician friend of mine, Mr. Robin Armstrong, I believe, and he did a little trial in Galveston with 100 patients in a nursing home, and I wanted to see if he had also seen the elevation in the liver enzymes with people that have infections with COVID. And unfortunately, he was not able to get the lab to come in and draw blood on these patients. They were afraid. But he does have an outpatient practice, and he looked into that and called me back and said, yeah, we're seeing the exact same thing. We're seeing elevation of liver enzymes. So I've been following that, JoAnne, and what I've done is I've got these patients coming back once a week so that I can check their liver enzymes. And within a week, the numbers are coming down. Within 2 weeks, most of the patients are completely cleared and their liver's back to normal. Now, in the meantime, because I didn't know what I was looking at, we were checking for hepatitis panels to make sure that we didn't have other comorbidities. But really only one patient showed up positive for hepatitis. And what I found out in my research is, this virus acts a lot like the parasite that causes malaria. And so the parasite that causes malaria causes night sweats and night fevers. But if you do a little research on this parasite, it goes to the liver. And so people that suffer from malaria have elevated liver enzymes. And so we're looking at a virus that may be somehow manipulated or has evolved to contain some part of the malaria parasite DNA. I don't know. And so that is something that we're really looking into. But for me, I'm looking forward for November, December, when we start with our seasonal flu in Dallas. And how am I going to be able to differentiate my seasonal flu patients from my COVID patients? And one of the ways I think I'll do that is probably my seasonal flu patients don't have nocturnal fevers. They don't have night sweats. They'll both have body aches. But I've never had a seasonal flu patient with influenza that has had elevated liver enzymes. And so I think if we use that as something to, obviously it needs to be looked at, needs to be investigated, but as a screen. So most of my patients, when they come in, I do blood work and I have it the very next morning. And if those liver enzymes are high, I'm on alert. This is a COVID patient we need to treat. And then they're anxious to go back to work because you have to realize if you've been sick for a couple of days and then all of a sudden within 48 hours, you're normal, what do you want to do? You want to go back to work. And so trying to guide them in when it would be safe for them to go back to work is pretty stressful for me because I don't want anyone to get infected. And so I've got to find a way to do this. The criteria now is 15 days of quarantine. And what I've noticed is within those 15 days, the majority of the patients, their liver enzymes have resolved and gone back to normal. And so that may be how we differentiate seasonal flu from COVID-19 come October, November, December.
Wow.
Great.
I'm reaching out to other doctors to see if they're finding the same thing. And again, other doctors that I've spoken to, they do see the elevation in the liver enzymes. They don't all agree with me that it's caused by the COVID-19. And what I do want to tell people is don't use Tylenol because Tylenol goes to the liver. And so we don't want to use Tylenol if we suspect that we've got COVID-19 to treat the fever.
Yeah. I heard ibuprofen is very bad to use. People should not take ibuprofen if they think they have COVID-19.
Here's another thing, too, that we have to be really, really careful with is, as we get older, we don't present with normal temperatures. So patients that I have in my office that are in their 70s, 80s, and 90s normally don't have a normal temperature of 98.6. And so one of the things that I've noticed in my patients that are older, if they come into the office and they've got, let's say, 99 or 98.9, and they normally have a temperature of 96 or 97, that's their core base temperature, that is an elevated temperature or a fever for them. And so, I'm telling patients, check your temperature at night, but if you have night sweats, you have fevers, you have chills, don't wait, go to your doctor. And I'm really frustrated that a lot of my colleagues are closing their offices and not seeing patients and not examining patients for fear of contracting this COVID. And
God bless you, doctor. What a blessing. You're such a conscientious person. You demonstrated tonight how much effort you're putting into your practice for your patients. God bless you. I wish every doctor out there had your backbone.
Well,
Thank you so much.
Don't doctors, I mean,
remember, James, it's not so much that they don't have the backbone. They're being silenced because they work for hospitals. They work for large medical groups. And so these hospitals and these medical groups are so, adverse oriented. They're so afraid of being sued or having some kind of litigation that they would rather do nothing at all than actually treat the patients. And that's what Obamacare did to us.
In their heart, they know that what they're doing is not right.
Yeah, because
their conscience is still there, so they don't have the backbone you do. God bless you. You do have a backbone.
That is correct, and that they do know that. And I will tell you that a lot of these doctors are very upset about not being able to treat their patients the way they would like to treat their patients. And usually the comments that I get is, I can't do that. I mean, I wish I could. I agree with you, but my hands are tied. And this is why I wanted to come on today. I just want all of these doctors that have the opportunity to watch this, to reach out. I'll be more than happy to talk to anybody, give them my experiences in my office. I'm sure that this is probably not going to be the cure for all, right? But I just think that instead of sending them home with no treatment, if they're clearly showing signs of this virus, I think it's almost inhumane not to try something. And again, I really do appreciate the fact that the president came out and said this publicly. He did this for weeks until they literally shut him down. And so I think he has saved millions of lives. I really do.
One last thing I want to touch on, because I know you've got to go, Dr. Lozano, but it is very brave of you to come forward and say this. You're essentially doing what Dr. Daniel Erickson and his colleague did, and it was amazing to me that even during the press conference, these two doctors were attacked by the reporters, and immediately they went to, you're making this point that most doctors either work for a hospital or some pharmaceutical company or some large medical company of some kind where they've got someone to answer to. There's a separate category of doctors like yourself who are in private practice, and that's a unique situation because you're not just a medical professional, you're a private business person, and obviously you've got a business to run like anybody else, but you're in the business of being a doctor. So right away, these two were attacked, and the allegation was that because they run an urgent care clinic similar to yours, that they must be doing this for some financial motivation. It's a very stark contrast that no one is questioning Dr. Fauci, Dr. Birx, Bill Gates. What about their financial motivation for billions of dollars? It's a little bit ridiculous to presume that you coming on a podcast is somehow going to explode your medical clinic in Dallas. It's really only accessible to people in the local area there. And what Bill Gates, Dr. Fauci, Dr. Birx, Dr. Tedros, the WHO, what they're doing is they're basically strong-arming everybody in the world and fast-marching us towards mandatory vaccination that will mean billions of dollars for the pharmaceutical industry. It's just so blatant. It's just naked how obvious this is.
And I wanted to comment on that because I think that's such a good point. So the president of the United States has kept these two bozos up there standing next to him during these press conferences. And so I'm thinking, this man is brilliant. There must be a reason for him to do this. And this is my take on it. I think that the president wants to expose to the rest of the world how ridiculous the recommendations of these two quote, quote, professionals are. I'm also going to comment on these two physicians that came out and they spoke out against this. And the fact that, the American Medical Association, their licensing board is looking to sanction them. Wow. They've gotten into a whole bunch of trouble just from coming out and speaking. And so this to me, again, brings back this, communism, socialism, control of the population through control of health. And, I don't work for the Texas Medical Association or the Dallas County Association or the American Medical Association. I work for the 18,000 patients that are in my office. And I think that my loyalty is to them. And so I needed to do research on my own. And the research that I did was such as these two wonderful physicians that came out. I listened to what they told me. And not just these two, but there were many doctors. There was a physician in New York that treated over 800 patients, and he had wonderful results with hydroxychloroquine. If I didn't have anything else that I could offer my patients, why in the world would I not try something that other physicians in the United States were trying and being successful with? And with my patients, I explained to them, there's no guarantee, but this is the experience that I've had. And obviously the first patient was probably the scariest for me to treat. And I'll tell you, I didn't sleep very well that night. And I called her at 7:00 the next morning. And when she told me that she felt better, I just can't tell you the relief. And it just made it so much easier for me to treat patient number 2 and number 3 and so on and so on. And so now I have no fear. And that's what I wanted to get across to the public. Don't be afraid. I've spent the day answering phone calls from people in all parts of the United States. My doctor won't write this. And my response is, give him my number, let me talk to him. Or in my state, it's not allowed. And my response is, find an independent physician that will write this off label. And so I'm trying to just get the word out so that we can protect ourselves as a society, because I don't think the answer to this is a vaccine. And I'm going to share with you why. Okay. Viruses are very tricky. They constantly change. We may already have 2 or 3 different forms of this COVID in the United States right now. I believe that I had a case of COVID-19 in November. I think I treated another case, probably 2 more cases in February before this all exploded. The problem with the vaccine is we have spent millions and millions of dollars on HIV, the virus. And we don't have a vaccine for HIV. Why then would we even contemplate that we would be successful finding a vaccine for COVID-19 that's only been around for a couple of months? And the fear in bringing out a vaccine too soon or too quickly that hasn't been tested and proven is thousands of more lives that we can lose, or leaving people paralyzed from the side effects of vaccines. So we need to be rational. We need to be logical. We need to be calm. If we have a treatment modality that we can use, we need to use that. And we need to be very, very careful about pushing a vaccine or mandating a vaccine to a population when, let me repeat, 98% of people that get COVID-19 recover. In Dallas, we had 111 deaths as of last Saturday. How many people die of heart disease? How many babies do we murder through abortion? I just think we need to be sane about this. The high numbers in New York, in my opinion, have to do with the treatment protocol. We did not know that if we put them on ventilators, we would blow out their lungs. This is not a hypoxia caused by pneumonia. This is a hypoxia caused by high altitude sickness. And the treatment for these patients is not ventilation through ventilators, but ventilation through high dose oxygen, nasal cannula, or a mask. And we've seen that because they've been treating these people in Europe with high dose oxygen supplementation and not ventilator therapy.
There's been so much talk about the ventilators here in New York. We've had, Dr. Cameron Kyle Seidel, who I have a lot of questions about, Dr. Colleen Smith, who I have even more questions about, and they've been behind this big push and pull with Andrew Cuomo, where they needed ventilators, they had ventilators. We've heard from Dr. Scott Jensen, who's a state senator in Minnesota, that the Minnesota Board of Health was telling him that, and other doctors, that there was a certain type of Medicaid or Medicare payment to a hospital that was much larger if patients were ventilated. There was another nurse.
$30,000 per patient on a ventilator with a diagnosis of COVID.
And then there was a nurse.
When we incentivize treatments financially, we kill people.
Right.
We cannot
Right.
people
Exactly
according
right.
to financial compensation and gain. We should not be, giving more money for diagnoses. If you
Right.
go into a hospital and you're diagnosed with COVID, the hospital automatically gets I think it's $13,000. That's ridiculous. Absolutely preposterous. And so, people are human, and you just that you do not do incentives for therapy or treatments based on financial gain.
It comes back a bit to what you were saying about Obamacare, because it was basically sold to the public. Even the name, Obamacare, it seems like the government is caring for you. It was really a big program to sell medical insurance to people.
Yeah, you just don't have enough time on your podcast to talk to me about Obamacare.
Well, and it's also interesting that the company Serco, the British firm that's been implicated in a variety of scandals in the UK and here, they're involved in prisoner tracking. They received $1.2 billion to process Obamacare applications. And I've never heard Barack Obama or any proponent of Obamacare talk about the improved health outcomes, the improved overall health of Americans. I have heard them say that 95% of Americans now have health insurance, which seems like a good deal if you are an insurance company.
They don't have health insurance. They have a card. Because when you go in to see a physician using Obamacare, about 75% of the time, you don't see a physician. You see a mid-level provider. So a lot of these Obamacare clinics popped up with mid-level providers. And this was the fallacy. The poor in this country has a right to be seen by a physician, a medical doctor trained in the United States. And with Obamacare and some of the laws that go around it, I've not read it, it's 1,700 pages. A lot of the poor and the needy were shuffled into clinics that were set up specifically to be able to take advantage of the Obamacare setting. And these patients never laid eyes on physicians. And it was a very large money grab. So we have pretty much destroyed the independent family physician. There are very few people that are in solo practice in America right now. And it's solely because of Obamacare. They had to close down their practices. They just couldn't afford the overhead. And their practices were not sold. Their practices were stolen. And a lot of the elderly doctors just gave up and just retired early. So we could go on Obamacare for a long time. It was a bad idea. And I have a lot of hope that the president will completely do away with this. It will go to the Supreme Court, and it is unconstitutional. And there is no doctor that cared about his patients that thought this was a good idea. They just
unconstitutional because the government was forcing people to buy medical insurance. You mean?
Absolutely, yes. Absolutely.
Yeah. Dr. Lozano, what do you think about people being required to wear face masks?
So, from a doctor's point of view, we've got the Surgeon General telling you publicly that he does not agree with face masks, that he does not recommend face masks. I've never in my medical career, and I'm a surgeon, so, I wore a mask to the operating room and obviously did not want to contaminate the patient I was having doing surgery on, or have blood splattered in my face. But actually, the mask is dangerous. We exhale carbon dioxide, so we don't want to breathe that in again in the mask. And we have our own germs that we are literally breathing in. We have viruses that live in our nose and our nasal cavity. They're dormant there. And so it's completely crazy to think that we can save people's lives by masking everybody. That's just ludicrous. But what I do believe is that people have a right, if they own a business, and it's a private business, to require their customers to wear a mask. And their customers have a right not to go to that business. So right. I, for one, don't appreciate having to put a mask on to go buy groceries or to go pump gas or whatever it is that I need to do. And I will try not to frequent those establishments. But that does not mean that I believe that they don't have a right to request the mask. Now, does the government have the right to tell me to wear a mask? And the answer is emphatically no. And our governor in Texas has stated that this is voluntary. He has also stated that nobody in Texas is going to get fined or put in jail because they're not wearing a mask in public. And I've seen atrocities. I've seen moms and children's in playgrounds being handcuffed and taken away because they're not social distancing with their children that they live with, and fathers, being taken away with screaming children left behind. This is lunacy, what we're seeing. There's never been a time in the country where we have masked healthy people. Now, if you are sick and you're coughing and you're, sneezing, then it would be very nice for you to protect yourself. If you are an elderly person and immunocompromised and you're going to go to the grocery store, it's very smart to protect yourself. So I'll give you a real quick example of my grandmother. My grandmother lived to be 103. And during her last couple of years, she didn't travel much outside of the house. And on occasion, she would get sick. And as the physician in the family, I would try to figure out how in the world, if she doesn't go anywhere, she's getting sick. And what I was able to extrapolate was that every time her grandkids came to visit her, there would be some grandkid or great grandkid that had a sniffle or a runny nose. And of course, it was called allergies. And so I put a stop to that. And so no one was allowed to come and see grandma if they had allergies, sinus infections, you name it. If you were not 100% healthy.
Oh, we lost you there. Sorry, Doc.
By her family in the middle of the night in her sleep, it was beautiful. And I would like everybody's death and transition to be that way. And so we have to protect our elderly. We have to protect our nursing homes. But we're not protecting our nursing homes by not letting family members go to visit their loved ones. And we are definitely not protecting our nursing homes by forcing these nurses to wear masks that scare the crap out of all of these patients. But you know how we protect our nursing homes? By installing more sinks and forcing the people who work there to wash their hands and to not cross-contaminate these elderly. Maybe not have more than 2 people in a room. And if an elderly in a nursing home is ill, if we can move the neighbor out to another room until that illness is gone. Now I want you to remember, we lose between 40 to 60,000 people every year from seasonal flu. And the ones that we lose are obviously the elderly because their immune systems are low. So there's a lot of things that we can do to protect our elderly. I think that people in nursing homes should be given vitamin B12 shots. And that should be done on a monthly basis. But if you think about it, how many doctors really do take care of the patients in the nursing homes? When I've had a patient go into the nursing home, I lose contact of that patient. That patient gets taken over by the physician in that nursing home that does not know the patient, does not have a history of the patient, and then the care is not good. It's not optimal. And so I would love to see a transition where if I have a patient that needs to be in a nursing home, I'm allowed to continue their care. But a lot of these nursing homes do this, again, for financial gain. They have their own doctors, their own internal system, so that they can take over all of the insurance benefits from these patients. Guys, I have a Sunday school class. Bye.
God bless you. Well, one thing, Jason, you're seeing in Texas, we have a very affectionate term when somebody has a backbone, demonstrates that they're doing what's right. And doctor, you cowgirled up.
There you go. Thank you.
God bless you.
Thank you very much. Thank you for letting me
know you, Dr. Lozano. Thank you so much.
Bye-bye. Bye.
Okay. Thank you very much. So we've had a little bit of our unfortunate audio problem there where we lost connection, but I think we've got it back just in time. Sorry we weren't able to give the doctor a proper goodbye, but there's always something going on over here. That was an excellent interview with Dr. Lozano. Thank you so much, Jimmy and JoAnne.
Isn't she a great lady?
She's conscientious. She's looking out for patients.
Yeah, but she's going so intelligent. Yeah. She's right on top of it. And, doctors take an oath to treat and to heal. Yeah. To heal, not to hide in their house when someone gets sick. This is kind of you got to look at the backwardsness of this.
Yeah.
Very conscientious gal.
Yes, I was very pleased that Dr. Lozano was able to join us. Just disappointed that we had that technical problem there at the end, but we've got you guys back so we can carry on here. That was really excellent to get the input from a doctor who is in the field. I wanted to share with everybody real quickly here. We were talking about this video of a mother in Australia who was arrested for not socially distancing. Now, we've seen videos of this happening kind of, all over the place. Let me see if I can share this with everybody here.
This is heartbreaking.
It's worse than that. I mean, this was pure brutality.
Evil.
In my I mean, this is, you'd have to go look at Nazi Germany to see something similar to this. I mean, this boy looks to me like he's maybe, I don't know, 5. How old is this kid?
Not very old. She kept asking.
Maybe
kept asking,
4,
what did I do wrong? Why are you arresting me? What did I do wrong? They wouldn't answer.
Can you get the sound up, Jason?
Yeah.
And the little boy starts crying.
Calling for her husband.
She has held all the people way back there.
The police grab the little boy. He's shrieking. Look at them grabbing his mother.
You choose her, everyone. You choose her. I'm passing that to her. Why are you? She's got a baby. She's got a fucking baby. You don't touch the baby. Leave her alone. Leave her alone. What are you proving? You're not me.
Look at the size of this officer handling the woman.
Yeah. They yanked the boy away.
It's a female officer initiating the arrest.
Everybody, they grab a woman with a child. Yeah. Out of everybody, this is fucking shit. Yeah. This is shit. Out of everybody, they grab a woman. Let her go. Let her go. Let her go.
You need to get out up on the top and beat him down. This is terrible.
What?
Yeah.
Do this. That's what I'd like to know. What person who takes an oath to protect people would do this to him?
Look what you're doing, man.
Look at this. This little boy is traumatized for the rest of his life. And it hasn't even gotten bad yet. They physically beat this woman.
Yeah. And one man saying, why are you doing this?
Well, I think anybody knows, no matter the species, you mess with a mother and the baby, and you better be ready to kill or be killed.
What has she done? Look.
That's right.
She hasn't done anything. What has she done? I'm not yelling. I'm not yelling.
I don't know him. That is his mother. He needs to be with his mother.
Come on.
Take him away from his mother.
I'll just stay back.
You hear the boy screaming.
Yeah.
See, Jason, this is where I've said I've down. And this kind of absolute abuse.
And brutality.
What about these cowards who are blocking the video, allowing this to happen? They should be telling the female officer, why don't we just let everybody go home? Look at the boy. They're holding the boy. His mother's being shoved in a van. This is a different angle than what I saw yesterday. What I saw yesterday is that extremely tall cop goes over and starts punching the woman in the van, shoving her in there while the boy is screaming and crying.
Yeah.
I mean, are they trying to manufacture terrorist cop killers? This is going to make a maniac out of this kid.
Well,
really bad.
You better go out in numbers, more numbers than the cops, because you're going to have to defend yourself in numbers, because if they single you out, you see what they're going to do to you.
Did you see what happened? I saw a video yesterday of Laguna Beach in California. There was a girl walking on the beach, and she took her sign and she said, I don't follow, I don't comply, the beach is free. And 3 or 4 policemen approached her, and a whole bunch of people were standing on the side, and they all started towards her. I mean, probably 100 people started walking towards her. The cops backed off and went away. And then people were saying, she opened the beach. She opened the beach. Wow. And so they all just stayed. That's what happens. The police are afraid if there's enough people, they go away. Because they're bullies at that point.
But how did the world get in this position? How did we ever allow enough criminals to get in positions of authority, not only in this country, but all over the world, that we allowed them to put us in this box as slaves? And like one of the attorneys here in Texas said, he said, you put a mask on your face and they make it a violation for you to touch your face, because in essence, when you got a face, you can't touch your face.
When you got a
he
mask.
said, this is not right. And what we saw another person, they said, the best mask that any of us should use is a Harlequin mask, because then it'll defeat their facial recognition software, and then we'll be wearing a mask, But I mean, it's ridiculous that we have to go to these measures.
There were 2 little boys in China that died from exercising with masks on.
And they're testing
you sent me that.
They're testing this new virus. They were testing it in Senegal, and World Health Organization, this new vaccine. They went into World Health Organization, sent a doctor in, and he injected 9 kids. 7 of them died on the spot.
Jeez.
And the people in Senegal were outraged. They were going to kill the doctor.
They were going to kill the doctor.
They said, "This is murder. This is Senegal. We're not going to do this."
Yeah, we don't allow this in Senegal for children to be killed.
And in Libya, the World Health Organization has given Libya the criteria about how they're going to test for this COVID-19. And we had one of the doctors there that we spoke to yesterday. He said, they've given us the test for flu. He said, it's the same way we've been testing for flu for as long as we've been testing. And he said, this is ridiculous.
Libya has about 60 cases.
Yeah, of probably flu.
Of flu, yeah. They don't have
now,
anything.
as the doctor said, you incubate and you're probably going to, ventilate, and you're probably going to cause more problems, which is we're seeing. Okay. It's just backwards.
I want to share an image with you guys. This is not a comedy image from some, new remake of 1984. This is a photo I snapped on my phone walking by a construction site the other day. I mean, this is like straight out of Ingsoc. I don't know what this logo says right there, but it's like, hey, wear a mask. Be safe.
Yeah. The point is that if you're wearing a mask, why do you bother anybody else who's not? So you're protected yourself. Why are you worried about anybody else? They're the ones who are going to get sick. If they're not wearing a mask, it's their choice.
I just don't think it's a valid thing for the government to make a universal medical recommendation to every person without understanding what their physical problems are. I mean, I see people prior to coronavirus walking around the supermarket with a dog, which the Department of Health says dogs are not allowed in stores that are intended to sell food to humans. And although I like dogs, I agree with that. We don't want dogs urinating on things and they lick the ground and eat feces and they're coming into a supermarket.
That's a different deal.
Yes, but there's a lot of people who abuse that. And what I'm getting at is, if someone has a condition that causes them to violate the state law that prevents animals from coming into the supermarket, how can that person be exempt from that law, but someone else is forced to wear a mask to enter the same supermarket? It's just none of it makes sense.
It should be painfully evident to everybody that this has not one damn thing to do with a disease or an illness. This is a way to scare everybody, to control everybody, put us in a lockdown position. They've been 33,500,000 jobs lost in the United States in the last 7 weeks. We're probably above 20% unemployment, even though they're claiming about 14.5%. The dollar is dead worldwide, and now the U.S. Treasury is out demanding currency swaps with all these other 140 countries that the Khazarian mafia owns those central banks, because the U.S. Treasury dollars are worth nothing.
What did Dr. Lozano say? She said, destroying a country through the healthcare, through fear.
Yeah. And so, we're seeing, and we've got to ask ourselves, how did we get in this position? Well, it's been the death by 1,000 cuts. They take a little bit away, and Hitler's the one that said, you take a little bit away, you take a little bit away, you take a little bit away, you take a little freedoms away, and finally, when they realize that they've lost all their freedoms, it's too late for them to do anything about it.
It's the frog in the water. When you turn the boiling water up slowly, they're in the water, they don't realize it.
And when a pharmacy is instructed to violate the code of ethics between a doctor and the patient,
right?
They got the pharmacy doing that. That's bullshit.
They demanded that
that's criminal. And whoever is forcing that pharmacy to act as an adversary to the doctor, who's doing that? That is unacceptable. We need to be stringing these guys up.
That would be CDC and NIH
and Fauci and the rest of them.
That's right.
Well, it's facilitated by all the governors. I mean, this duo right here are the perfect pair of idiots, because it's a combination of an idiot governor and an idiot mainstream news idiot who together can disseminate falsehoods and convince a bunch of people to be scared. And it's really a very destructive team, these two. And I think it's very important that Andrew Cuomo's political career end. I think Chris Cuomo's news career should end. It's just so destructive what's gone on. I really do want to thank you both for inviting Dr. Lozano. She's in a unique position to educate us not only about her own personal experiences there in her medical practice, but what she said about socialism and its impact on medicine and her experience with her family and her life in Cuba and how that's happening here now. I think we should try to get her back and talk about that some more.
Yeah,
sure.
You know,
She's
we've
real
chosen
bright.
to
Yeah,
do
she's powerful.
today's episode on YouTube so that everybody can see it. There's a lot of people who ask us to do that all the time. But of course, the problem is we can't sustain this if it's constantly on YouTube, particularly given the ongoing threat that YouTube could delete and destroy our platform at any time. So for people who haven't seen Jimmy and JoAnne before, every Monday night we're doing a sponsor-exclusive show called Unseen Libya, where Jimmy and JoAnne give us a lot of details about their time in Libya. They remain in touch with the tribal leaders in Libya, and they've got the best information. You know, General Flynn has said this, the best human intelligence the United States has ever had on Libya. So people can join us weekly on patreon.com/James and JoAnne Moriarty, patreon.com/crowdsourcethetruth, and subscribestar.com/crowdsourcethetruth. And people who want to learn more about Jimmy and JoAnne's time in Libya can visit their free website, LibyanWarTheTruth.com. Jimmy and JoAnne have put together a DVD about their harrowing escape from Al-Qaeda. They're the only known people to have survived being captured. The DVD is $15 and it's $5 to ship it domestically in the United States. If you become a sponsor of Jimmy and JoAnne on patreon.com, you're going to get free shipping on the DVD. We haven't spoken too much about Libya today, Jimmy and JoAnne. Was there anything you wanted to talk about before we end the show?
Just a short update. It's Ramadan now, so it's quiet, but the war goes on. I mean, the fighting goes on between the Erdogan mercenaries who are brought in there from Syria and Turkey. They're radicals. They're backed by the Muslim Brotherhood, backing the illegitimate government in Tripoli, and the LNA, which is the Libyan People's Army, fighting to clean their country. They attacked a room in Mytiga Airport. They bombed a place in Mytiga Airport, and the UN condemned the Libyan army for doing that. And the room they attacked was the war room for Turkey in their country. And the general, who's the spokesperson for the army, said the UN sees with one eye and hears with one ear. In other words, they're totally
only half the story.
They aren't getting the story, and they don't get it on purpose because the illegitimate government there was appointed by the UN.
And I've got another real disturbing fact that I need to bring forward. The UN Security Council attempted to cause a ceasefire worldwide during this COVID-19.
I think it's the last
pandemic.
link on that. See if it's.
That's the last link on that.
It may be on there. May not. No, it's not on there.
The vote, every country voted to have a ceasefire, and the United States vetoed it. Why would the U.S. veto a ceasefire? Why would the U.S. vote not to stop war?
Who's doing that vote?
The United Nations
Security Council put forward with all the countries a worldwide ceasefire because of the COVID-19. The U.S. vetoed it. They're the only country. And they said they vetoed it because they didn't like the word World Health Organization was in the paperwork. That was their excuse.
What?
I know. Yeah, that's what we said.
Makes no sense at all. But I mean, you know, this has such a bad optic for the United States, constantly doing something that should aggravate the world. We also, Jason, we had a full show on a lot of further explanations about how the banking got us in the position we're in. We'll do that next week. We thought it was really apropos to preempt our show and bring Dr. Lozano on because she's just a really neat gal, hardworking, one of the most honest physicians that we've ever met.
We met her personally. She came to one of the events we did in Dallas in 2013 when we were first starting to talk at tea parties and at what was the other one? John Birch Society and some of the other ones. And we sat with her privately and talked to her for a while. She told us her story about Cuba. She had her daughter with her. And
she has amazing stories about what happened in Cuba. Someday, when we've got time, we should have her on for that, because it is absolutely a gripping story about what really happened in Cuba.
She was very interested about what the U.S. did and Obama and Clinton did in Libya. And we told her what we saw, and we told her what happened to us. And she told me today, she said, I will never forget you. You sent bone chills down my back, and it all proved to be true. And she's, so she's a
bright gal.
Yeah, she's a companion. She's a simpatico with us, She knows and sees what's happening.
We'll get her back on.
She
There's
fights
a couple
for
more
people.
shows,
She really wants people to have good health. She cares deeply about them.
Yeah.
Right. And you've got this video of her speaking. Maybe what we'll do is post this for the Patreon sponsors, people who are sponsoring you guys and Crowdsource the Truth on Patreon and Subscribestar, so people can see what the doctor said there at this.
Doctor, a true patriot. She has been a worker in the trenches for years for your liberty and your freedom.
This would not be allowed in New York City. We would have the police come and shut it down. Possibly in Sydney, Australia, they'd beat up a few little kids. Maybe they're, intimidate their moms, throw them in a van, get some big, tough, brave guy to beat up a woman. Really disgusting.
This is an open Texas rally in Dealey Plaza in Dallas.
Oh,
it was right after Shelley Luther.
Where Candy was shot.
Yeah. And this is where Shelley Luther was there speaking. The lady who opened her hair salon.
Right.
And so they had a number of. I think the Oath Keepers were there. Alan West was there.
And she's become a Texan. She's wearing cowboy boots in this video.
Yeah.
There's actually a restaurant called, it's Texas de Brazil. Not Texas, but Cuba. Well, but it was really great to meet Dr. Lozano, even just over Skype, and to see the doctors that are coming forward. See, there's a lot of things about the political aspects and business aspects of being a doctor that perhaps the general public isn't aware of, why it's so difficult for some doctors to come forward. And when we see a doctor who owns an independent clinic coming forward, that makes sense. They make decisions for themselves, just like any private business owner. And it just puts more attention on these doctors who are young doctors in their 30s, working for hospitals. These are generally people that don't want to rock the boat. And it's not, people will say, oh, well, they're trying to save lives. That's why they're doing it. That's incorrect. That's not going to work. They're going to get fired and they're going to lose their ability to save any lives. What Dr. Lozano is doing is saving lives.
You hear her say she had 18,000 patients?
Yeah.
Yeah.
That, there's a show, a series on TV right now. It's in its break time. I don't know. I think it's been renewed. It's called The Resident. And I don't know if you've ever seen it. It's been on for a couple years, but it's all about the corporation that controls the hospital called Red Rock.
Right. And it's all money.
And it's all about money. And these doctors are fighting for their patients, and they're being fired. They're being thrown out. Patients are being sloughed off into nursing homes that are half dead. It's an interesting take on the reality of what's happening.
Wow.
But God bless Dr. Lozano. She's a great gal, and you've got another viewpoint about some things, some alternatives that should give people that are worried about COVID-19 some hope that there are some treatments out there. This is not a dead end street,
right. And she's very well spoken. She's very charismatic. She's a good spokesperson for this because she's speaking from her experience, and that's real important.
A lot of people, and you've included this in the PDF, so maybe we'll talk about this before we end the show, but a lot of people are very concerned about this House Resolution 6666, the COVID testing, reaching, and contacting everyone Act, the TRACE Act. I think it's important for people to know that this is a House resolution that hasn't yet been passed, right? And even if it is passed in the House, it's got to pass the Senate.
But the sorry bastards went out and got the sign of the beast as the number for it. So that should tell you what it's about. And the things.
All Democrats were the ones who started it.
And Gates has come out and demanded that everybody that issues or that injects people with poison be indemnified. So everybody involved with his vaccine, he wants them all indemnified because it's got aluminum and mercury, and it's got the element that really makes it is integral is an enzyme compound called luciferase. Luciferase.
Really?
It's the enzyme compound that in the butt end of a firefly makes it light up.
Huh.
And so he's included that as a part. And Lucifer is known as the light bringer. So here, this sorry piece of garbage has included in this vaccine luciferase as one of its main compounds.
Jason,
That's
that thing
bizarre.
going back to that bill or whatever it's going to be, the 6666, the Trace Act. I sent that out to a bunch of my friends. One of them is now he's a retired attorney from Nevada, and he's an old friend. And he wrote back and he said, "Let him try." He said it may go through the House, it may go through the Senate, it may get signed by the president. It won't stand up in the Supreme Court. It'll be thrown out tomorrow.
Wow.
But you got to get
right.
it to there.
Right.
And incidentally, in Texas, when this gal was thrown in jail for opening her salon, her attorney took it to the Supreme Court, and the next day, this is how quick the Supreme Court, how much pressure they had on them. The next day, the Supreme Court ordered her to be released from jail, and they said it may take us some time to analyze all the data.
Shelley Luther.
But she was released at order of the Supreme Court the next day. So the Supreme Court got enough pressure from Texans, I guess, threatening to string them up and make them sing in a higher voice. All those things were done. The Supreme Court immediately had her released.
Yeah, but also there was pressure on the governor here, so much pressure on the governor that he said, "I never intended for anybody to ever be jailed for anything like this
or
fine." So he rolled it back to April 2nd. He grandfathered it in back to April 2nd. You cannot be jailed. You cannot be anything for not following any of these things.
Notice all the lawyers and the judge are wearing these masks. It's ridiculous.
Yeah. He wouldn't let her attorney speak, the judge.
He made her attorney sit down. The attorney was going to go in. What's the legality of this? Isn't this anti-constitutional, And the judge said, "We're not even going to hear about that. You sit down." So her defense attorney was not allowed to defend her in court. Draconian again.
The judge demanded that she apologize and state that she's a very selfish person for not following his orders. And she said, "I'm sorry, but I have to disagree with you. I'm not selfish for wanting to feed my children." Yeah, he's a big Barack Obama, and he has beat other judges up in their chambers.
He's them up physically?
Yeah, physically. He's got some guys behind him, but he is a lot of people. Now, I don't know if this is true. I even hate to say it, but I see on blogs all the time, people from Dallas say this man is a racist against white women. He hates them. I don't know if that's true or not. I'm saying that. I don't know. It's a hearsay
but
thing.
In every judge ever contacted, except the 12 buddies he's got in Dallas, they said it is impossible to consider that a judge would ask somebody to apologize to him.
They said he can't do it. He said he doesn't have that kind of.
Justice is supposed to be blind.
Yeah, he's looking at evidence and whatever. He's not looking at someone's personality or what he wants. He says that's like talking to a child that did something wrong. He said it's really bad what happened. He's running for office, by the way, and there's a nice lady running against him.
Yeah.
He's been a judge for over 25 years and currently presides over the 14th Judicial District Court in Texas.
Yeah.
Well, there's a lot of judges who have been exerting way too much power. Oh, look at that. He received his law degree at Harvard. That's interesting.
Yeah.
Yeah.
I don't think I trust Harvard at all.
No, I wouldn't trust him anywhere.
Den of snakes.
He's from New York. Born in 1954. So this is a guy who, as a young boy, obviously would remember, institutional racism and segregation and all that. And while I'm sensitive to that, he can't allow that to translate into his job as a judge in 2020 and take it out on this woman and act like a jerk. We're going to have to see what happens to Eric Moyer. I'm glad that his decision got overturned there. I think it's been a really good show today, Jimmy and JoAnne, and I do want to remind people that they can watch us every Monday night on patreon.com/James and JoAnne Moriarty and patreon.com/crowdsourcethetruth. You know, Jimmy and JoAnne, a lot of people say, oh, you know, why don't you just put these things on BitChute if YouTube is going to delete it or whatever it is. The point of the matter is, I think that most people recognize that when you guys come on the show and other co-hosts come on the show, everybody's working really hard, spending a lot of time to put this information together, and it just wouldn't be sustainable. It's not like we're trying to take something from people. We've tried to create a system here where there's virtually no financial burden on the individual, spread it out over a lot of different people rather than having these centralized sponsorship sources the way that corporate news does. This is a plan to take the economic influence out of the news. And it's just impossible to think, just like the doctor was saying, Obamacare isn't going to work. Nothing can be free. It's not sustainable. People need to do work to earn money. And we've developed a system of commerce that reasonable people understand. So I'm so pleased that you guys have been able to join me and help me build this network on Crowdsource the Truth. And I'm really thankful to the generous Patreon and Subscribestar sponsors who've created a condition where you guys can continue coming on the show, bringing on these great guests. I want to thank you both again, and we'll be back next week. Anything you'd like to say before we end?
Yeah, I'd like to thank all the patrons and angels and everything that we met through Patreon and with your help, because we get so many kind words of encouragement. It really helps us a lot because we've chosen a real hard road to hoe. I've said that many times, but we have so much support. People write really nice letters to us. They say they hear our truth. They pray for us and support us, and that really helps us a lot. And it's almost like we've got an extended family from all the people.
They say, you know, you're just real people. That's true. We're not out there. We're just trying to expose the truth. That helps us a lot, and we thank you too, Jason.
Thank you, Jason, because without your help, we'd have never gotten here. And you're a great guy. You work harder than anybody recognizes and knows, and we thank you so much.
Yeah,
God
you're
bless
great
you.
support, and I want to tell everybody, if they join Patreon, they get all the past shows.
Yeah.
That whatever, once they open that Patreon, whether they do $2 a month or whatever they want, that we have shows back with Jason back to, I think it's December of 2018, isn't it, Jason?
Yeah. Way back there,
yeah.
Yeah, because when we met at the conference in Dallas, well, I appreciate everything you guys are both saying. And frankly, it makes me happy to know that something that I've been able to create is helping you and helping to benefit the other co-hosts on Crowdsource the Truth. So I'm really proud of what we've built, and we couldn't do it without the viewer sponsors. I want to thank everybody for watching. I want to thank everybody for making this possible. And I want to thank Jimmy and JoAnne for bringing Dr. Lozano to us tonight. I hope we'll have her back again soon. Have a great night, everybody. We'll see you tomorrow.
Good night. God bless you.